Hello, nurses of Canada. Voici mon bonjour virtuel de la EEC. On behalf of the CNA Board of Directors and myself, Judith Shamian, your president, I want to talk with you about the progress of nurse practitioners across Canada. I want to talk about how CNA is working with you to improve healthcare for Canadians. Your success as nurse practitioners, as leaders, and as strong voices for the nursing profession is critical to the future of good healthcare in this country. And CNA's success as an organization is dependent upon the energy, creativity, and the insight of members like you. As you know, nurse practitioners work in diverse settings, including family practice, community health centers, nursing stations, NP-led clinics, and specialized care teams for tertiary, long-term, and home care. It is a well-known fact that nurse practitioners improve access to care. Nurse practitioners deliver quality and safety outcomes equal to other providers. Furthermore, Canadians trust nurse practitioners. For example, 88% of Canadians say they would be comfortable being treated by a nurse practitioner at a walk-in clinic. In Winnipeg, when a full-time nurse practitioner position was introduced in the nursing home, dramatic improvements in medication use were observed, including a 17% reduction in overall drug cost. Moreover, family satisfaction with the quality of healthcare provided to residents increased by 24%. The value of nurse practitioners in primary care is being increasingly recognized. Quebec is investing $117 million to create 500 nurse practitioner positions in primary care by 2018. And Ontario has been integrating NPs into primary care for several years. That province also made commitment to funding 25 NP-led clinics that will be operational by 2011-2012. Progress has occurred everywhere, but it has been uneven from region to region. In many parts of Canada, NPs are sailing into somewhat uncharted waters. We need to raise the awareness of obstacles to advance nursing practice by advocating positive changes to elected representatives, officials at health ministries, and other relevant decision makers. I received a letter from a nurse practitioner in British Columbia. She expressed concern about the lack of NPs integration into the BC healthcare system. The British Columbia government encouraged schools to set up a great learning infrastructure to educate and train nurse practitioners, only to fall short on its promises to provide funding for positions just a few years later. How disappointing. As a result, some NPs are unable to work, which is a terrible waste of expertise, and others have moved to other provinces such as Ontario, which are only too happy to integrate them. Needless to say, policies that call for nurse practitioners to be trained but will not integrate them are short-sighted and wasteful. Not only that the cost of money in the long run, it is terribly unfair to underserved and orphaned patients who desperately need access to primary care. What makes sense is to treat patients on the primary care side of the equation rather than the far more costly acute care side. And we have all the research to support it. What makes sense is to carefully monitor and manage chronic disease before complications set in. And what also makes sense is to trust these jobs to advanced practice nurses. It makes good financial sense, it makes good patient care sense, and it leads to good clinical outcome. And Canadians know it makes good everyday common sense. Understandably, as millions of baby boomers come to rely more heavily on the healthcare system, governments are looking to reduce cost and improve access to care. Ontario has begun exploring the development of regulation that would allow NPs to admit, transfer, and discharge. That province has the highest number of NPs in Canada, close to 1,700. You will want to check out our special feature on NP-led clinics in the November issue of the Canadian Nurse. And perhaps soon we will see similar changes in other provinces as well. CNA strongly supports the integration of NPs across Canada and has for more than 10 years. CNA is actively encouraging media to spread the good word about NPs and bring to light the real issue facing our health system. And we are very glad to see highly respected health reporters like André Picard tell the nation that outdated laws, especially those pertaining to narcotic prescribing, need to be modernized to improve patient care. Good for him. NPs are frustrated. They cannot do more to help patients who are suffering. They have the knowledge and they want more, but there are barriers. In Quebec, NPs are called super infirmiers or super nurses. Haven't we always known this? I like this notion. Besides, it's good press and it's easy for the public to remember. So super nurse it is. We are all super. My promise to you is that CNA will continue to raise awareness with all external stakeholders, including government policy advisors, government policymakers, elected officials, and media. Because despite success, more needs to be done. Since our landmark 206 report, Nurse Practitioners, the time is now, we have been tracking progress on various fronts. With funding from the Federal Office of Nursing Policy, we published recommendations of the Canadian Nurse Practitioner Initiative Progress Report in 2009. Results show that more than half of the 206 recommended actions have been fully or partially completed, but several key actions still need to be implemented. And we need your help to continue to push that agenda forward. Among the remaining challenges to NP practice is continued advocacy on federal legislative or policy barriers. This includes prescribing controlled drugs, distribution of samples, medical forms for disability claims and workers' compensations, and I'm sure there are others. CNA has created 4 working groups for the development of new action plans to integrate NPs. This will focus on legislation and regulation, education, health human resource planning, and communication. So much work remains in many of the above areas. Progress is being made. The imperative to try new approaches in healthcare delivery created a real opportunity for advanced practice nurses to bridge the gap within our health system. I see a role for nurse practitioners in the evolving trend toward increased emphasis on disease prevention, wellness, and health promotion. Again, we talked about it for decades. The transformation of our health system should be about what's best for Canadians, and we should never forget that. What is best for Canadians? As such, it should address the real problems they are facing, and that involves changing the way healthcare is delivered. The Canadian Association of Advanced Practice Nurses is providing very valuable ongoing advice to CNA in this respect. In its recent report on the health system transformation, the Canadian Medical Association reported that approximately 5 million Canadians do not have a family doctor, a situation that severely restricts access to adequate primary medical care. This report goes on to suggest that physician extenders, such as physician assistants, are a key part of the solution to the problem of access to primary care. Strangely, there is not one single mention of the term nurse practitioner in any of the report's 48 pages. It's hard to collaborate with colleagues who do not acknowledge our contribution. It seems like some people's idea of collaborative care is still a bit shy on collaboration. But we are there to continue to push along. That's fine. Physicians who work side by side with nurse practitioners are very strong proponents of new models of care and show great promise in easing the primary care bottleneck. And there are many stories, and many of you nurse practitioners, I'm sure, have many of those stories. Our success in the field speak for themselves. With that, I invite all nurses to work hand in hand with CNA, their provincial or territorial association, and the Canadian Association of Advanced Practice Nurses in championing the cause of advanced nursing practice. One of the most important things we can do is reach out to the public as we educate those around us about what an NP does and why this work is so important. We continue to encourage a cultural shift that places the health of the public at the top of the Canadian healthcare agenda. Merci beaucoup. Thank you. Let's keep working on this agenda.